Hello and welcome back. In this session, I am going to be telling you everything you need to know about back pain and pelvic girdle pain in pregnancy and postpartum. What are some of the causes, risk factors, and how you can manage that pain? Okay, so there is a collective term for pregnancy-related lower back pain and or pelvic girdle pain, and that is lumbopelvic pain. It can affect up to 86% of pregnancies. So if you are pregnant at the moment, this is quite relevant information to you. And this term, this sort of umbrella term, lumbopelvic pain, is the collective term given when pain is coming from the lower back and the pelvis, but when a person can't really pinpoint where that pain is coming from. Now, this type of pain is most common in the third trimester, and some people can experience it months after birth. It's most people's experience that that pain sort of goes away, almost straight away as soon as the baby is born. But for some people, it can last, and we'll talk about some of the reasons why that might be. So this sort of pain in pregnancy is absolutely no laughing matter and no joke at all. And I think sometimes there is tendency to just go, oh, this is what pregnancy is all about. But it can have really negative repercussions on things like sleep, your social and sexual life, your ability to work, your physical capacity, because, you've still got to, do things in the home, look after other children. And it can have really huge psychological, impacts as well. And of course, contribute to being physically inactive. Um, but despite how common it is and how significant this impact is, the causes remain unclear. Now, there's a number of possible risk factors for this type of pain during pregnancy, but most of these observations are based on observational data. Um, so it makes firm conclusions hard to make, and then it means that effective pain management is also hard to recommend. But I'm going to cover as much as I can because being informed and having that information is a step in the right direction to sort of understanding why that pain is there and then managing it. So, risk factors and possible causes. So, the first thing you might hear a lot about is the hormonal changes. So, that hormone relaxin, which helps loosen the spinal and pelvic ligaments to assist in childbirth. Um, that is not, unfortunately, that hormone. It doesn't just act on the spinal and pelvic ligaments, it acts all over the body. Um, and there's a lot of talk about relaxing causing instability, but the evidence on this is not that clear or reliable. There's not good evidence of a direct relationship between ligament laxity, so things becoming more loose, in the pelvis, and pain in that area. So when studies have tried to measure relaxin levels at different points in pregnancy, that doesn't always correlate with the amount of pain that people are experiencing. And of course, in other conditions where joint laxity is an issue, some people experience lots of pain and some people don't experience any. So the relationship between having those looser joints to assist in childbirth, it's not clear whether that is a direct cause of pain or not, but that is something that you might get told. Biomechanical changes, so think about your posture, so your spine and your pelvis. Um, much is known about the biomechanical changes that take place during pregnancy, but there isn't much research on how this contributes to pain because, again, everybody has a different experience of pain during pregnancy. Some people don't get any, some people get a lot. Um, and although many people experience more lumbar lordosis in the lower back, so that is when, so if you look at this little image down in the right hand side, that curve of the lower back, which means that the pelvis is tipping forward. Although you'll experience more of that in the third and second and third trimesters, it's not certain whether that actually leads to pain or not because some people just have this as a natural posture anyway, pregnant or not, and they don't experience any pain. So this sort of forward shifting pelvis is actually really important for you keeping balance. because your center of gravity is ever changing whilst you're pregnant. So the ability for the pelvis to move is really important, and it's actually a really good thing. And just to confuse things further, there are also lots of studies which don't observe any major postural changes in the third trimester compared to non-pregnant controls. So it's not clear how biomechanical changes impact pain, but again, it might be something that you get told by healthcare professional, or you might see it online somewhere. And then we've got neuromuscular changes. So that is to do with your motor patterns and how you move, how your muscles sort of talk to each other to create movements. There isn't much research on this either. In how changes in movement control during pregnancy relate to pain in the lower back and the pelvis. But as your center of gravity and posture shifts, you must adjust how you move. That is a given. It's like when you sprain your ankle and you get back to walking, that ankle still feels stiff and in pain. So you just change the way you walk to adapt to that. And it's exactly the same in pregnancy. You've got a huge thing in the middle of your body, a huge baby that is in the way of doing certain movements. So, if you think things like getting up out of bed, getting up off a chair, that all changes. But moderate evidence suggests that changes in how the pelvis moves can lead to pelvic pain. But again, it's just not that clear. Um, we also know that this is also very individual. So how you adapt your movements during pregnancy will be very different to how somebody else adapts in pregnancy. So that's why we can get into a little bit of um, confusion, because a lot of people will say these are the best exercises for um, back pain or pelvic pain. But depending on how you've adapted, how you're moving, what muscles are being relied on more, they might not be the exercises for you. So we need to be very a bit wary of people who are claiming that they have the best exercises, because this stuff really does affect everybody different. So lifestyle changes can also have an impact. So some studies have found that pregnant women who exercise regularly throughout their pregnancy had lower levels of lower back pain and pelvic pain. However, it's not clear whether that's causative or not, because it might be the case that those who didn't exercise regularly avoided it because of pain, or if the pain resulted due to inactivity. So we don't quite know the relationship there. But as always, if you can move, make sure that you try and keep as active as possible, because it may have a protective effect. We just don't know for sure. And then there's other risk factors, most of which can't be controlled or changed, just like everything else: age, number of pregnancies, previous injury or condition which affects the spine and pelvis. And if you've had a history of non-specific lower back pain, you are more likely to experience pain in pregnancy. Now, pain is really complex, and it's likely to be caused by a complex interaction of things, and that's going to differ from person to person. So, anybody who is trying to explain your pain away through just posture or just inactivity, or focusing on just one thing, also just take that with a pinch of salt, because it's likely to be a combination of things that are unique to you as an individual. Really interestingly, lots of studies have looked at the sort of clinical profile of pregnant women, and what they found is they tend to have widespread deep tissue hypersensitivity. So, for example, if when you're not pregnant, if someone was to like press in your lower back, yeah, you could probably feel it, but you go, it's not painful. Whereas when you're pregnant, if someone was to do the same thing, you would be registering that as being a lot more painful than when you were not pregnant. And this correlates with disturbances with sleep, and lower levels of well-being, overall physical and emotional health and general well-being. So it's thought that this hypersensitivity is a mechanism which prompts pregnant folk to take better care of themselves, because if you're responding more to pain, if you think back to the more sort of animalistic kind of pregnancies, if you're more aware of pain, you're going to be doing things to avoid dangerous situations. So that's where researchers think this hypersensitivity comes from. But obviously now we don't always we don't need this sort of mechanism, but it's still there. So that's why it's really important to do what you can to keep yourself feeling comfortable and relaxed and as safe as possible. And if you think back to that fear avoidance cycle, this sort of hypersensitivity could lead to a cycle of avoidance, avoiding certain movements, and then this will result in more pain. So hopefully it's quite clear of how pain can stay even when there isn't, there's no longer an explanation for it. So baby's born, your body's able to go back to, your posture and everything is able to return to how it prefers to be, which does happen. But then why is that pain still there? And it can be through things like this hypersensitivity, and then being sort of in that fear avoidance cycle of pain. Now, we've got loads of studies that are exploring exercise interventions for preventing and managing lower back pain and pelvic pain, because it's seen as like a cheap and accessible intervention. And if it can reduce pain, then great. But unfortunately, no specific strategies have been proven to be effective long term or in the short term at the moment. Now, some evidence suggests that individual exercises might slightly reduce long term lower back pain. But that sort of those individual exercises, it's got to be like a tailored plan. So the movements have got to be quite individual, to you and the sort of movement patterns that you do already. um, and a lot of the time you may hear talk about stabilizing and strengthening the core and training the pelvic floor muscles to enhance pelvic stability. And there's lots of talk about, weak, tight, and instability in the body. But this aim really is like this approach to correct impaired control of that area, um, is a huge oversimplification, and may not address the real issue at hand. We'll talk a bit more about why we can't say the pelvis is is unstable, in a moment. But basically, you will find your own way of moving. So there was one really interesting study that looked at different types of muscle activation in pregnant folk who had really bad pain, and they found that it wasn't uniform. So each person with pain had a slightly different muscle activation pattern, which sort of shows you that there's no like one way that your body will adapt to that pain. So this how complex you are as a person and how your body adapts to things probably explains why research studies have had such inconsistent results when they're giving everybody one set of exercises, and for some people it's working and for some people it isn't. So it's you are so individual, cannot stress that enough. So if you found that some certain exercises haven't been working for you, it's nothing that you've done wrong. It's just that your body is doing things differently as it should. So a more personalized approach, considering individual differences and personal preferences, might be more effective. And as personal trainers, it's better if you're being treated, you know, given exercises that are more meaningful to you and what you enjoy, and things that make you feel confident and strong, and all the rest of it. So, yeah, again, I'll repeat, just being cautious of anybody who claims to have the best exercises for reducing pain or talks about instability or weakness in the core, as it's not that helpful to think of your body in those terms. And also people who were talking about, certain muscles being weak and tight, as that might not be a reflection of what's actually happening in your body. Just taking all of that sort of stuff with a pinch of salt. So I'm going to talk a little bit about pelvic girdle pain, as it's it's often reported separately from lower back pain, despite the two of them often existing together. It's still really popular to treat pelvic girdle pain as a purely biomechanical issue, similar to what we see with back pain as well, with lots of talk about instability and misalignment of the pelvis. So you'll often be given a straight leg raise test, which is meant to assess the instability of the pelvis and its alignment. But if somebody fails this test or does it slightly differently, that is not a proof that the pelvis is out of alignment or unstable. It reflects those highly sensitive pelvic structures, so that overall hypersensitivity. So here are just some things that I really want you to know about your pelvis during pregnancy. So on this diagram, you'll see two black circles, and they are highlighting the two joints in the pelvis. So you've got where the sacrum meets the ilium, which is called the sacroiliac joint, and then you've got where the pubis meets in the middle, and that's called the pubis symphysis or symphysis pubis joint. It's called different things on different sort of different parts of research. So these are the two main joints in your pelvis. Um, if you have ongoing pain, so especially after birth, a physio or even a doctor might do a hands on assessment or tell you to do this straight leg raise test. From that test, they might tell you that you have SI joint dysfunction or pubis symphysis dysfunction, where these joints have moved. Now, what we know from research is that movement of these joints can't be assessed by the straight leg test or even with a hands on assessment. So, some physios might actually like press around your pelvis and then tell you that these joints have moved. It cannot be accurately assessed hands on, only with a scan. And there isn't much evidence that displacements of these joints even occur, especially the sacroiliac joint. This only moves a tiny bit during pregnancy, and for good reason, because it needs to be strong, as it's your main load bearing bone in the body. It doesn't tend to come out of joint very easily. You're looking at things like impact injury, like a car crash, and even then, it doesn't tend to happen much, because you're more likely to break your pelvis in another place than that joint come out of place, if that makes sense. The pubic symphysis, so the bit at the front, that can move a little bit, but it's not directly associated with pain. And extreme amounts of movement in it are quite rare. We've only got a few case studies on where those have happened. And normally, the treatment is to wear a brace to feel, more confident that your pelvis is supported, and to keep moving. That's the advice: to load bear on the pelvis, keep moving, and then that joint can be, will sort of move itself back together. Only in very rare cases is surgery required on that. So that's good news. Just shows you again how well adapted the body is to pregnancy. Um, Again, a physio or a doctor might recommend that you need to have manipulations, or sometimes they call them corrections, to put the bones back in place. But there's no evidence that hands on manipulation can move your internal structures. So it would be better to either push for a scan to see if has been movement in those joints, or to just keep moving, try and get a second opinion, try and find a physio or a doctor that is working from more of a biopsychosocial approach. And if you need any help with that, then you can let me know. Now, here are some things that I need you to know. So, pelvic pain means that your pelvic structures are sensitized. Movement avoidance, so thinking about that fear avoidance model, muscle tension, lack of sleep, inactivity, stress, and worry can sensitize them even further. Your brain acts as an amplifier, so the more you worry about your pain and focus on it, the worse it gets. It's unlikely that your pelvis is out of place. The joints in your pelvis do not move very much, even in pregnancy, and they are some of the strongest and most stable structures in the body, which is great. You are literally designed to do this. Studies have shown that the pelvic joints don't move position with hands on manipulation. You wouldn't want them to, because imagine if somebody could just grab you and move your pelvis. That would be a terrible design. When you feel like your pelvis is out of alignment, it usually reflects that muscle tension has given you the perception that you are lopsided. So this is an example of you changing your movements or posture in response to pain. So again, some of the assessments will be, they'll say that you're standing to one side, but that's not a sign that it's out of alignment. It's just that you've changed your posture to, you know, to help reduce pain. So the majority of pelvic girdle pain disorders get better, especially if you have confidence in your body and manage your health, which is one of the reasons why I wanted to put all this information together to tell you how amazing your body is. You've got to think more positively, sleep well, um, relax as much as possible, and move as much as possible, because this will all help your pain. Now, thinking positively isn't about just saying you can think your way out of pain. It's just, you have, if you worry more, you will feel more pain. So you've got to, you know, manage that pain in the best way that you can. If you think that you need to protect your pelvis, or that it's unstable or weak, and you need to avoid movement, that can make your pain worse. So the relaxed, confident movement is going to help. Think back to that fear avoidance model of pain. If you think that you need to protect and stop doing certain movements, then that can make your pain worse. The pelvis is resilient and adaptable to the demands of pregnancy, childbirth, and childcare while maintaining its stable structure. It is one of the most stable structures in the body. It has literally got you. It's got your back, literally. Your spine is attached to it. Postural and pelvic structural changes are normal, safe, and necessary to support the growing demands of pregnancy and childbirth. So don't worry about your posture changing. Just try and move as much as possible, change position, give yourself rest and relaxation, and really try and look after yourself. Now, if you've if you've got ongoing pain, pain education, taking care of your emotional well-being, sleep optimization, exercise, and external supports that promote your independence in movement are the most helpful strategies. If anybody needs a recommendation of someone to talk to, please get in touch. And any exercise or movement will do. So remember, you don't have to be looking for specific movements. If you enjoy walking and you find that accessible, then do that. If you like going to the gym, you can do that. It doesn't have to be, there's no secret exercises that are going to help with this stuff. But researchers found that the strongest predictor of pelvic girdle pain not becoming chronic, so not becoming long term after pregnancy, is the belief that it won't. So please believe in how incredible and strong and resilient and adaptable your body is. And like I say, if you need any extra help, just reach out and I will hopefully be able to point you in the right direction.